Good day, I'm Fiam Lara, and I will be performing the diabetes urine test using the Benedict's solution method. First procedure is greet the client and introduce the self. Greeting the client to establish rapport, and then introducing the self para po malaman ni client kung ano po ang name ko, and also to start a better conversation. So, magandang araw po, Ma'am Ann. Ako po si Student Nurse Fiam ng Manila Central University. So, andito po ulit ako sa inyo. Magandang araw po ulit. And then, next is explain the procedure with its rationale. Explaining the procedure para po ma-reduce yung anxiety ni client and also para din po malaman niya kung ano po ang gagawin sa kanya. As well as para po malaman niya kung paano siya magpa-participate during the procedures. So, Ma'am Ann, nandito po ulit ako sa inyo para naman po i-test yung ihi niyo po. Titignan lang po natin kung may kitang sugar po sa ihi niyo at matignan po natin kung nasa magandang condition po kayo. Okay na po ba sa inyo yun? Okay po. And then next is gather all the materials needed. Gathering all the materials to continuously and properly perform the test or procedure.
Urine in early morning, Benedict's solution, alcohol lamp, match, 3 cotton balls with alcohol, kidney basin, 2 droppers, test tube holder.
And then next is instruct the client to urinate and then gather the specimen using a clean container. So, para po magkaroon ng specimen for the test, kailangan po na mag-collect ng urine ni client and then placing it in a clean container para po hindi makontaminate yung specimen. So, ma'am, okay lang po ba na umihi po kayo kasi kailangan ko po ng ihi niyo po para po sa test later. Dito niyo lang po ilalagay yung ihi niyo po. So, okay lang po ba sa inyo yun? Okay po. So, assuming that the client already urinated. Next is place the paper lining in a flat clean surface or table and then it should be clean side out. The purpose of this is to prevent the bag from getting contaminated. Next is place the plastic lining over the paper lining and then it should be clean side in. The purpose of this is also to prevent the bag from getting contaminated. Next is place the bag away from the client and then tuck the handles. So, away from the client para po ma-prevent ulit na yung bag na makontaminate and also to protect the client. And then tucking the handles para po hindi makasagabal while taking out all the necessary materials for the procedure. Next is take out the apron, the soap and dish, and then the towel. So, taking out first the need materials para po hindi makontaminate yung other materials if lahat po ay ilalabas agad. So, the apron, towel, and then soap and dish. And then next is do thorough hand wash and then dry the hands. The purpose of this is to prevent further transmission of microorganisms, also to protect the client. And then place the soap in basin and then the towel near the bag para po organize and hindi makasagabal while performing the next procedures. And then I will also wear gloves to prevent my hands from getting contaminated. Next is put on the apron and then it should be right side out. The purpose of this apron is to protect my uniform from getting soiled and contaminated. Next is take out the kidney basin and then 3 cotton balls with alcohol. So placing the 3 cotton balls in the kidney basin because it is sterile and it should not be contaminated. So my cotton balls already have alcohol. And then I will place 3 cotton balls. 1, 2, and 3. Next is take out the test tube holder, then 2 droppers, and then place it in the kidney basin. So they are sterile and clean materials, so it should be placed with other sterile and clean materials. Kaya kailangan po na nasa kidney basin and it should not be contaminated. So the 2 droppers, test tube, and then the test tube holder. And then next is take out the alcohol lamp, the match, and then the Benedict's solution, and then place it in the working area. They contains liquid, so dapat po nakahiwalay po sila sa clean and sterile materials. And then next is take out the waste receptacle and then place it away from the clean materials or outside the paper and plastic lining because it will contain soiled and contaminated materials, so it should be separated. And then next is light the lamp para po mag-ready for the urine test. So next is place 6 to 8 drops of urine in the test tube. And then I will put my dropper near the waste receptacle because it is already contaminated. Next is place 3 to 5 ml of Benedict's solution in the test tube together with the urine. I will now place this dropper near the waste receptacle because it is already contaminated. And then I place 8 drops of urine and then 5 ml of Benedict solution because it is the required amount for the Benedict solution method. Next is with the use of test tube holder. Place the test tube over the flame to gather any reaction po. And then place the mouth away from the client and also to the nurse to prevent any further accidents po. So it already reaches its boiling point. So stand for 1 minute for to gather any reactions pa po. And then also put off the flame to prevent any further accidents. Next is interpret after 1 minute. So the specimen is clear blue or clean blue. So in interpretation, if it is clean blue or cloudy green, it is negative. And then if it is bluish green, it is positive 1. Yellowish green is positive 2. Yellow is positive 3. And then orange is positive 4. Next is drain and wash the test tube holder, and then the droppers. And then with the use of soap and water. Then place it in the working area. So kailangan po na i-clean and drain yung materials because it is already contaminated, and to keep it clean and sterile, and also to prevent any further infection towards the client and also to other next client. So I already washed the materials, and then next is disinfect these materials using 2 cotton balls with alcohol, and then place it in the kidney basin. So disinfecting these materials to keep it sterile and clean, and then prevent also further infection towards the other client. So I'll first disinfect the kidney basin. Next is disinfect the lamp and the plastic lining with the use of 1 sterile cotton ball left. The purpose of this is to keep the plastic lining and the lamp sterile and clean. Next is dispose the waste receptacle. The purpose of this is the waste receptacle contains soiled and contaminated materials, so it should be disposed properly and immediately. So I will also dispose these gloves because it's already contaminated. Next is do thorough hand wash and then dry the hands because my hands is also contaminated, and to prevent further contamination of other materials and prevent further transmission of microorganisms. Next is return all the materials used to their proper places para po madali ulit kunin for the next other treatment and hindi magkagulo sa bag, and also to make the bag organized. Next is remove the apron away from the body, and then it should be contaminated side in, and then place it between the flaps of the bag. So, away from the body para po ma-prevent na mag-transmit ulit yung microorganisms sa uniform ko or sa katawan ko. And then it should be contaminated side in because para po yung clean side na lang po yung magiging in contact sa clean material sa loob ng bag pag binalik ko na po yung apron. And then placing it over the flaps of my bag para po madaling ulit kunin for the next other treatment. Next is fold the plastic lining. It should be contaminated side in, and then place it over the flaps of the bag. So, the plastic lining should be contaminated side in para po ang magiging in contact sa clean material sa loob ng bag is yung clean side. And then place it over the flaps of the bag para po madali ulit kunin for the next other treatment. Next is hold the bag and then fold the paper lining. It should be contaminated side in and then discard. The paper lining is the most contaminated material, so it should be discarded immediately and properly. Next is close the bag and then lock. The purpose of this is to para po hindi na mawala yung mga gamit and ma-contaminate pa. Next is take the record, have a talk with the client, write down all the data that had been gathered, observed, as well as the treatment rendered, and then instruct the client about the care in the absence of the nurse. So, taking the record and then writing down all the data to have a reference for the next visit, and then having a talk with the client para rin po malaman ni client kung ano po yung condition niya and also yung naging kinalabasan nung test, and then instructing her for her to become independently take care of herself in the absence of the nurse. So, Ma'am Ann, yung naging result po ng test nyo, wala naman pong nakitang sugar sa urine nyo. So, it means po normal naman po yung ihi nyo and wala pong dapat ipagkaalala. Ang kailangan nila pong gawin is uminom lang po ng tubig palagi. And then next is make an appointment if it is home or clinical visit, and then take note the date and time. The purpose of this is for the follow-up care of the client. So, ma'am, babalik po ulit ako sa susunod na araw para patignan po ulit yung kalusugan nyo. So, November 29 po iyon. And then, babalik po ako ng mga bandang 10 a.m. to 11 a.m. po. Okay na po ba sa inyo yun? Okay po. And then, that's all for the diabetes urine test using the Benedict's solution method.